Body Shop Physical Therapy. I'm Dr. Catherine Price, and today I'm going to share with you how to perform pelvic clocks and what they're used for. This is for the lumbosacral region, so the lower part of your back. If you've got stiffness or restriction, if you have difficulty either bending forward, bending backwards, or you have pain in those movements, the pelvic clocks can help with this, and it's going to help restore and maintain the mobility. I use muscle energy technique in the lumbosacral region to help restore and correct joint dysfunction. So once the joint dysfunction is corrected, the pelvic clocks can be used to help maintain the joint movement. So if the spine, it's not opening or closing symmetrically and with good movement, you can become stiff and dysfunctional on one side of the joint or the other. So what this looks like when you're sitting, if you sit up tall, you're going to close your back down and you're going to have closing. So if it's painful to extend and sit upright, that can be a closing problem in the back. The same thing if you're standing and you bend backwards and it's painful, or you have restriction bending backwards, it is a closing problem. So the joints are stuck open and we want them to close. If I slouch or if I bend forward, I'm opening those facet joints. And if that becomes restricted or painful, my joints are stuck closed and I need to open those joints. So you can have a therapist evaluate you to find out where you're dysfunctional in those joints. And then there is something called muscle energy technique that can help restore the joint movement. And so we want to have extension and flexion. We want to be able to close the joints and then open the joints. And sometimes when you stand and someone's looking at you from behind as you bend backwards, you want to see that there is equal bending at each joint. So sometimes one joint will bend more than the other and you'll see a crease there. And that is indicative that all the movement is in that region, so there's some stiffness below or above. So to do pelvic clocks, I'm going to lie on my back with my knees bent and imagine a clock on my belly. So right over my belly, I want to imagine a clock. 6 o'clock is towards my feet, 12 o'clock is towards my head. This pelvic clock routine is going to take 8 minutes. I'm going to do 2 minutes going from 12 to 6 o'clock, 2 minutes 3 to 9 o'clock, 2 minutes I'm going to imagine the bottom of a bowl and I'm going to go into clockwise one direction for 2 minutes and then counterclockwise the other direction. So I'm going to begin setting my timer. And I want to go 12 o'clock to 6 o'clock. So I'm going to engage my abdominals and I'm going to bring, it's a posterior pelvic tilt. So I'm going to tilt my hips backwards so that the back is flattened. And then I'm going to use the muscles on my back to bring my pelvis forward. And I'm going to create a space underneath my spine. And I just want to rock back and forth, alternating in those contractions. So I'm going to contract my abdominals, contract my back muscles, contract my abdominals, contract my back muscles. When you're doing this, you want to pay attention that you're not pushing through your feet to get your back down to the floor. So some folks will tend to want to push the back down by using the feet rather than the abdominals. So I'm going to contract my abdominals. Then I'm going to track my back muscles. Those are going to be my multifidi, erector spinae. So I'm contracting the back, contracting the abdominals. And I just want to go back and forth. And as I work on this, it should become smoother. So you're just looking for the movement. And if you have difficulty with either direction, that is important to make note of because that will help the therapist determine what treatment is going to be best suited for you. So if you have difficulty tilting the hips forward and creating that space, then that means the joints are going to be stuck open and have a hard time closing. So you want to do exercises to restore the closing of the joints. If you have a hard time getting the back to the floor with engaging the abdominals, then it's going to be an opening problem, and there is going to be different treatment interventions that can help with opening the spine. After you do 2 minutes, 12 to 6 o'clock, then I want to go from, I'm going to start the timer again, and we're going to go 3 to 9 o'clock. So 3 to 9 o'clock, I want to engage my core so that I am tilting my pelvis over towards 3 o'clock. So 3 o'clock is going to be on my left side, and then 9 o'clock over to the right side. And so I'm just engaging my core to tilt my pelvis back and forth. Now, if there's asymmetry here or difficulty going to one side, usually that's going to be a sacral dysfunction. So the sacrum is going to then be assessed to see how to restore the joint movement between L5-S1 and then the sacrum, the SI joint. So I'm just going to tilt my hips back and forth from 3 o'clock to 9 o'clock. And I'm just, I don't want to push through my feet to rock my pelvis. I want to use my core, use my abdominal muscles, and also the back. So I'm going to be using a combination of muscles to rotate my pelvis. And I'm just alternating back and forth for 2 minutes. And if there is more restriction on one side or the other, pay attention to that so that your therapist can help determine what the dysfunction is and how to best treat that. So just rocking back and forth, paying attention that you're not using your feet and that you're using your muscles. And you can continue to engage the core. Then I'm going to imagine the bottom of a bowl, and I want to go down to, I'm going to start at 6 o'clock, 7, 8, 9, 10, 11, 12, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So I want to roll and imagine going through all of those numbers on my clock that is on my belly. And I'm just going to use my core muscles, mobilizing, and then paying attention. Do you have difficulty at one particular place? And again, that's just going to help determine the joint dysfunction. So it's going to be 12 o'clock. You're tilted backwards. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 1, 2, 4, 5, 6, 7, 8, 9, 10, 11, 12. And again, don't push through your feet. You're using all the pelvic muscles to do this, and your core muscles. So my transverse abdominals, my back extensor muscles. When I go to 12 o'clock, I'm going to be in that posterior pelvic tilt. When I get to 6 o'clock, I'm going to be in that anterior pelvic tilt, and I have a little bit of space. So just the bottom of a bowl, rolling. You want to spend 2 minutes. As you continue to work on this, this should become smooth. When I first started this, I had all sorts of sacral imbalance, and it was not balanced at all, which I thought that was just normal until the joints were corrected and able to feel a more smooth movement. All right, and then now I'm going to go counterclockwise. So I'm going to go, and I'm going to start at my 6 o'clock, and then I'm going to go 5, 4, 3, 2, 1, 12 o'clock, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 12 o'clock. And continue to go counterclockwise for 2 minutes, not pushing through your feet. And you may find that one direction is easier to go than the other. And you're just looking for smooth movement and seeing if you have any difficulty at any one of those numbers. And 12 o'clock again, I'm in that posterior pelvic tilt. 6 o'clock, I've got my anterior tilt, a little bit of space in the back there. Using my core muscles, my transverse abdominals in the front, my rectus abdominals, and then my back muscles, the multifidi erector spinae. And just picturing the bottom of the bowl rolling on the countertop, the floor, and looking for smooth movements. And pay attention and make note if any movement is painful or restricted. 12 o'clock. And that is 2 minutes of the counterclockwise. So that is the example of utilizing and doing pelvic clocks and helping with the restoring the mobility and the joint function in the lumbosacral region. So I hope this is of help and have a blessed day. Thank you.